As of Wednesday, more than 60,000 people in the U.S. have died from the coronavirus. It's the highest death toll of any country by more than 20,000. The pandemic is showing signs of slowing in some parts, though. That's partly due to efforts like social distancing. So, how did the idea come about? For the answer, let's bring in Eric Lipton. He's an investigative reporter for the New York Times. He co-authored an article in the Times called "The Untold Story of the Birth of Social Distancing." Eric, thank you so much for being with us. It's really good to have you.
Thank you.
So this concept of social distancing partially came from a 14-year-old science fair project. How did that lead to the CDC guidelines that we're using today?
This is back 15 years ago, and there was a student in New Mexico who did a research project at her high school that looked at how social networks worked at her high school. And her father worked at the Sandia National Laboratories, which does all kinds of work on nuclear weapon systems and other advanced science. And he took the work that she had done on social networks and how a contagious disease can spread and developed a model that showed that the interactions that occur at schools can be responsible for the spread of a contagious disease in a community like Albuquerque, and that just the schools alone can contribute in a major way. Even if the kids themselves don't get sick, their parents and other people in that community can get sick because of the social interaction among those children.
I happened to cover George W. Bush in the 2000s for a cable network, and I remember he brought up, and his advisors brought up, a book which was highly influential when it comes to this issue. Can you talk a little bit about the role that this book, The Great Influenza, played, and how it was he was already concerned about this in the wake of 9/11?
Right. So George Bush read this book by John Barry that looked at the pandemic from 1918, and in particular how the deaths that had occurred in Philadelphia as a result of the spread of this virus. And he was quite struck by it, having lived through, been president during 2001. And the United States after 2001 and the anthrax attacks that occurred in late 2001 was very focused on the potential for a biological attack or even a nuclear attack. But then he began to think, well, what would happen if there was a influenza that were to come to the United States like it happened in 1918? And that became an obsession of his, and it led to the adoption of policies, including the policy of social distancing.
Right, because one of the lessons of 9/11 was that there was a failure of imagination, and in the wake of 9/11, that very much seemingly influenced his thinking and other people's thinking on this. But you also write about the ethical questions, though, surrounding social distancing. What must officials consider when implementing these measures?
Well, I mean, there's a big difference between a quarantine in which a person is sick and therefore they're forced to isolate from other people so they don't get other people sick. And social distancing is a policy of isolation of healthy people. And so you're actually asking a healthy person to stay inside even though they're not sick. So what kind of legal power does the United States government have that to enforce that on you? And it became a federal policy, which again, it's up to the governors to have said stay-at-home orders. But the federal government concluded that at certain times when there was no vaccines or antiviral drugs that were available to treat an infectious disease, that social isolation was a necessary policy that we needed to adopt in order to limit the spread. And it's now credited perhaps with saving, perhaps hundreds of thousands of lives in the United States, although it's caused incredible economic damage and consequences for every family. But it has slowed the spread of the disease considerably.
So, we've seen protesters against some of these stay-at-home orders. This was a country built on freedoms, but as you pointed out, this is a proven measure that we know saves lives. But nevertheless, Eric, how is social distancing complicating our idea as Americans of what it means to be free?
I mean, part of the complication is that the testing was so flawed during this pandemic that we had no visibility into, in some of the rural states, there may have been very low infection levels, but because our visibility into how much community spread was going on, many states adopted these social distancing measures, even though there wasn't really compelling evidence that the virus was spreading and an imminent threat there. And so, a lot of states just followed after a certain point. But I mean, it certainly is becoming a civil liberties question, and there are demonstrators. But The problem is if you open too quickly in certain metropolitan areas where their case numbers are still rising, you will have a reoccurrence and a surge in deaths. And so each state has to evaluate, how prevalent the infection is in each state, and then make appropriate choices about when reopening is the right choice.
Right, and for that, all the experts say more testing is needed. All right, Eric Lipton for us. Eric, thank you very much.
Thank you.